So welcome to our new version of this webinar series from the Young Epilepsy section. Today we are pleased to welcome Dr. Sanjay Sisodiya. He is an adult epileptologist working on the UCL at the National Hospital on Queen's Care in London and the Chalfont Center for Epilepsy. His research interests are in trying to better understand epilepsy and its consequences, in particular in treatment resistance, genomics, and personalized medicine. He runs a number of international multi-center initiatives, including EpiPGX and Enigma Epilepsy. Having long been interested in sustainability and climate change, he set up an epilepsy climate change as a group of individuals working in epilepsy concerned about the effects of climate change on people with epilepsy. Welcome, Dr. Sisodiya.
Thank you very much, and thank you to the Young Epilepsy section for their very kind invitation to speak on this topic. This is something I think that's going to be a little bit different and outside our usual experience, but maybe I can interest you in this area. So, why should we be thinking about climate change? I guess as clinicians and scientists who use evidence base as justification for everything we do, then we're all interested in evidence. And there's perhaps nothing that's got more evidence behind it right now than climate emergency that we're all facing. And this is an extract from an article which has over 11,000 scientists from around the world who clearly made the statement that we are facing a climate emergency. And I would argue there isn't much else actually in any area of science that has as many people working on it, as much evidence behind it now as the climate emergency that we're facing. This is global. And these are just some very few examples of the sorts of things that we are all seeing, I think, in our daily experience, and that we see when it happens at extreme levels in the news. We know, for example, that low-lying islands like the Marshall Islands face extinction as a result of rising sea levels due to global warming. This is a beach off the coast of part of the United Kingdom called Norfolk, where you see a lot of erosion happening. We're all experiencing heat waves and extremes of temperature. And here we see a park that would normally have green grass. This is in Europe, totally dry. Floods in the United... Can you hear me? Yeah. Floods in the United States, landslides. I can't hear you. I think you're trying to tell me something, but I can't tell what you're trying to say.
We cannot see your face on the screen.
Okay. Oh, sorry. There we go. Okay.
Thank you.
Okay, sorry. So floods in the United States, landslides this is in Peru, glacier retreat here we see in Europe, wildfires in Australia, and people suffering all over the world as a result of changes and extremes which are likely to be associated with climate change. And of course, we're all currently in the middle of a global challenge, the coronavirus 2 pandemic. And I think this has taught us a lot of things, or reminded us maybe of a lot of things. The fact that civilization as we know it is not invulnerable. It is not immune to problems. And in fact, I would recommend, if you haven't already read it, an excellent book by Jared Diamond called Collapse. I think we've learned from the pandemic that we're all connected, and not always in ways that we would want to be connected. That even in wealthy countries, health systems can collapse or come near to collapse. And that global challenges do happen and should and can be met with global action. And I think we've seen this at local levels, at national and at international levels. We've seen how the world community has reacted to this very acute challenge. Unpredictable in the detail, but likely at some point to have happened. Now, on the other hand, climate change is something that we know is happening, that is not exactly predictable, but we know a lot of the consequences of climate change, and we know a lot about what will happen at different degrees of global warming. So I guess what the pandemic has shown us is that these things can happen, and they can really challenge not only our economic systems, but our health systems too. And we need to be thinking and acting about climate change now. Of course, different people have different perspectives of this. And there are some people who think it's not happening. There are other people who I think accept that it is, and others who are active in the area. I guess what I would say today is that as clinicians looking after people with epilepsy, then we have a duty to think about this and to think what it's going to mean for the people that we look after. If you look at any number of variables related to the climate, things are going in the wrong way. And this is a series of graphs from the paper signed by 11,000 scientists, which show, for example, of course, population is increasing and world gross domestic product is increasing, but so are carbon dioxide emissions, and emissions per capita, which I think is perhaps more concerning, are rising. Fossil fuel subsidies are still high. And of course, this promotes the emission of climate changing gases. So if you look at pretty much any parameter, things are getting worse and aggravating the emergency that we already face. I think it's important to consider how this is happening. So these are a series of graphics taken originally from the IPCC 2014 report. And what this shows is the probability of the occurrences, a probability distribution of, in this case, temperature. Now, as the mean temperature rises, we will see, of course, fewer cold weather events, more hot weather, and more record hot weather. If the variance also increases, if the stability of the system is disrupted, as it currently is, then we'll see a broader distribution. And that will mean both more cold weather and more record cold weather, as well as more record hot weather. If we add to an increased variance and increased mean, we shift this curve to the right, then what we're going to end up with is much more hot weather and much more record hot weather. And I think we're, at least in continental Europe, for example, experiencing this with some of the hottest summers on record in the last decade. Now, if we think about how is this going to affect epilepsy, is it going to affect epilepsy? I think there's some evidence of this. It's not really directly been studied, but within epilepsy climate change, we've been trying to gather the evidence that might be out there. So if we start at a very fundamental level, if we look, for example, at some very rare genetic epilepsies, okay, so this is not to say this is how it's going to affect everybody with epilepsy, but if we start at this level and expound outwards, then we can begin to see what might happen. So if we look at SCN1A, probably the epileptologist's best known and favorite ion channel. As long ago as 10 years ago, it was shown that the dynamics of this channel change with increasing ambient temperature. So you can see this altered response graph to stimulation from 21 to 37 degrees C. And this is a normal sodium channel. If we look here at a mutated sodium channel that causes a Dravet-like phenotype in people, then in fact, at pretty much any variable you care to look at, any measure of the performance of the sodium channel, you can see that it is altered at different temperatures. So for example, if you look at the normalized current, it's greater in the mutant channel at a higher temperature compared with the wild type channel at the same temperature. All the measures that are looked at in this paper were worse with higher temperatures and with mutation. So you can see that there's a multiplicative effect of the mutation, which is causing the epilepsy, and of increased ambient temperature. And this applies to many other fever-sensitive epilepsies. So for example, if you look at a mutation HCN2, which was associated with a human epilepsy, then in fact, when this mutation was introduced into a whole cell model, you can see that its behavior, it caused altered behavior with different temperatures. So this is the wild type at different temperatures, 25 degrees C and 38 degrees C, and you can see a certain current response. And here you can see that the current response is greater in the mutated channel. So it's likely that for many fever-sensitive epilepsies caused by mutations in ion channel genes, increased ambient temperature will cause altered dynamics of that channel. Now, of course, we all thermoregulate, And so it's not the case that, of course, the increased ambient temperature will lead to increased body temperature, exactly paralleling the external temperature. And of course, humans can take measures to try and keep cool. Nevertheless, we know that increased mean temperature can lead to greater problems thermoregulating, especially if there's increased humidity. And these were taken at the same degree of humidity. So this is something important that we need to consider. Here's another example. So these are zebrafish, which are being exposed to the chemoconvulsant, pentylene tetrazole. And you can see what happens here is that these zebrafish, these adult zebrafish, achieve stages of seizure, different degrees of seizure activity more quickly, i.e. with a shorter latency at higher temperatures. So for example, to get to stage 4, it's quicker at 30 degrees C than it is at 26 degrees C than it is at 22 degrees C. So I think there is evidence that increasing the ambient temperature can affect the way that neurons behave and neurons react to anti-epileptic medication or proconvulsant medication. Here's another example. This is a mutation that causes GEFS plus that was introduced into Drosophila. This is a mutation SCN1A. Here's the mutation. And what this graph again shows is that in comparison to the wild type here, introducing the mutation, and here it depends, of course, on the particular, this is a sex-linked gene, so it depends on which gender of the Drosophila we're introducing the mutation into, you can see that the probability of a seizure increases more dramatically at this higher temperature according to whether the mutation is present or not. So we've got an interplay between the mutation that's causing the epilepsy and ambient temperature, one aggravating the other. And this gets increasingly complicated the more you look at this. So this is some interesting data now that's 20 years old from Wolfgang Lörsch's laboratory, which showed that for a particular model, in this case a rodent model, sensitivity to chemoconvulsion actually varied across seasons, even though everything in the laboratory was kept otherwise the same. The lighting, the temperature, everything was kept the same. Nevertheless, as you can see here, the animals were more sensitive to chemoconvulsants at lower doses at certain times of the year compared with, say here, September. So in March and April, they were more sensitive than they were in September, with the suggestion that there's some kind of internal biological calendar, if you like, a kind of longer term equivalent of clock gene function. So there's an increased degree of complexity that we don't even understand yet. And that is going to be particularly complicated by what's happening to climate change, to temperature changes, and to humidity changes to which our bodies are not accustomed. And I think this is another example here of the complexity that underlies these phenomena. So this is the Gares rat, which, as you know, has been distributed across the world. And in this same animal with this epilepsy, you can see that in different areas of the world, so Grenoble or Istanbul or Melbourne, for example, this model shows different sensitivities, different seizure activities. So here, for example, you've got percentage of time spent in seizure activity, which appears to be higher in the rats in Grenoble than it is in Melbourne. It's not clear whether this is an environmental interaction with the genetics that's causing the epilepsy in these rats or whether there is genetic drift. But it goes to show that there is complexity here beyond what we can measure. So we might be thinking of a single mutation causing an epilepsy, but we can see that there are a number of complicating factors in the existing environment. If we now add to that unpredictability and extremes of weather and temperature and humidity in the environment, we can see how things could get much worse. And we know that with climate change, there will be other changes. And I think this is really the issue here. We're not looking at just racking up the temperature, but we're racking up the temperature in a very finely tuned system that's evolved over many, many hundreds and thousands of years. So for example, in this paper published in 2015, the authors modeled what might happen to the ranges of insect vectors of diseases such as chikungunya. So this particular mosquito is predicted to be able to breed and transmit disease for several months a year, even in this country, in the UK, in say 50 years' time, if there is a 1 degree C rise in global temperature. If the rise in global temperature is higher, then that is likely to occur quicker and to extend across greater parts of the United Kingdom. And this particular mosquito here can transmit virus-causing chikungunya. And this would be exposing a population totally naive to this condition. And this is going to happen at a global level for a range of different viruses transmitted by a range of different vectors. This is an added degree of complexity. And some of these viruses, as you know, increase the chances of seizures occurring or of chronic epilepsy. And the same will apply for malaria. And we know, of course, that as climate changes, human behavior changes, humans will migrate to different areas, there will be increased conflict between humans and the environment, and this will put humans in closer contact with other animal species. And we've seen this year the consequences of something like that happening with, for example, the emerging pathogen of the coronavirus causing the current pandemic. It all gets much, much more complicated. So I think this is one of the big issues, that we're not just talking about a simple rise in temperature. The rise in temperature causes a lot of different problems. So for example, we know that the rising temperature will lead to increasing floods, and floods will disrupt supply chains. Now, this is an example of what happens to supply chains when they get disrupted. So this is the Great East Japan earthquake of 2011. This is a slide from the Ministry of the Environment from Japan, which showed that here you see the epicenter of this earthquake, and you can see the different districts that were affected and the different degrees to which they were affected. And we know that this was a huge disaster, with many people unfortunately losing their lives, but also with damage to buildings, damage to roads, and damage to supply chains. So a group of authors in Japan looked at what happened to people who have epilepsy and what happened to their medication provision. This was a group of people actually with intellectual disability. And you can see, for example, they asked the question, did the person with epilepsy have sufficient medication during the acute phase of the disaster after the earthquake, when supply chains were disrupted? And here in this case, you can see that more than a quarter of people with epilepsy reported that there wasn't any change, but the vast majority reported that, sorry, the other way around, a vast majority reported they did have sufficient medication, but a significant minority reported that they didn't. And this minority had difficulties getting through to their carers, to their medical support, in order to try to work out what to do when they ran out of their medication. And of course, the authors explored this further and tried now to encourage stockpiling of medication to try to forestall this sort of event from occurring. So climate change is going to lead to a number of different risks for people with epilepsy. For example, increasing the chances of people with fever-sensitive epilepsies having more seizures, increasing the chances of more people being exposed to infectious agents that can cause epilepsy and seizures, increasing the risk and vulnerability of drug supply. And we've seen this happen. This is a reality. So this is the United Kingdom this year during the lockdown. Empty shelves. So supply chains are vulnerable, and the interconnectedness that we have in our world currently increases the vulnerability that people with epilepsy will be exposed to shortages of medication. And we know the consequences that may lead to. This group of authors looked at how climate change could affect sleep. So they showed in their modeling that with rising average and extreme temperatures, we're going to have changes in precipitation, more extreme weather events, which in turn will lead to a whole host of other problems, such as, for example, floods and droughts and wildfires, and which with all these other different events occurring will lead to loss of sleep, disrupted sleep, other problems associated with sleep, in the end all leading to insufficient and inadequate sleep. They didn't focus on epilepsy, but of course we know that insufficient and inadequate sleep can affect a number of other conditions. And of course we know that it can also affect epilepsy. It's not surprising that sleep will be badly affected by events like floods and forest fires, leading to mood disruption, post-traumatic stress, sleep disruption and deprivation. And we know that there are many people whose epilepsies are sensitive to disruption in sleep, leading to increased seizures. So what we have is a really complicated situation where, just as a result of global warming, as part of the environmental changes associated with climate change, we see a whole range of impacts in environmental conditions, which lead to a whole range of changes in, for example, social infrastructure with flood damage, storm vulnerability, heat stress, effects on food distribution and production, and as we've seen, medication distribution, which in turn puts stress on the healthcare systems that we all depend on, and which in turn has widespread effects on healthcare, including on what may happen for people with epilepsy. And these things all multiply. So, for example, if there's a flood, that will affect the supply chain. That will also separately affect sleep. And these things will therefore feed off each other, so that we have multiple factors all acting at the same time, which are likely to increase the risk of seizures occurring, for example, in people with epilepsy. So these changes are not going to be evenly distributed across the world. It's very likely that low and middle income countries will be most affected. And even within a given country, there will be regional variation. It's likely that this will particularly affect Africa, Central South America, and Southeast Asia. And one projection is that there will be 30 more extra seasonal heatwave days for each degree increase in average temperature in global warming. So what we're seeing is that we will have more of this. And that will occur especially in parts of the world that are perhaps even less resilient to these changes. And we know that entire ecosystems will be changed as a result of climate change. And this occurs at a range of different levels. So from genetics, physiology, changes, for example, in this paper were studied for animal morphology and animal behavior. And what these authors concluded was that there will be multiplicative impacts from the gene to community levels, scaling up to produce entire ecological regime shifts in which an ecosystem changes state from one to another. Now, that's of course always happened over the course of time, but that's happened slowly in a way that has allowed systems to adapt. Here it's going to have a much quicker effect, not as quick as a pandemic, but a much more profound and rapid effect. And so these authors also looked at a range of different impacts upon human populations. So for example, they noticed that there would be, for example, altered distribution of disease vectors, as we've already discussed, a redistribution of arable land, increased human-wildlife conflicts and contacts with novel disease vectors and novel diseases spreading to affect humans. And here's just one example of what can happen. So this is a simple organism. This is called Daphnia, or the water flea. Easy to study, an important part of many ecosystems, and we are part of an ecosystem too. And these creatures change dramatically in response to increasing temperature. For example, their body size increases, their behavior increases, their metabolic activity changes. They increase in numbers in response to an increase in temperature. And whilst they may increase in numbers, other creatures might not, producing an imbalance in the system. And in turn, they can lead to changes in the entire ecosystem occurring, because the whole synchronicity between different organism populations is altered. That's just for a water flea. What about people? What about impacts on people? We've seen already how complicated this all is. And we all know how individual every person with epilepsy is. Here is our Dravet Syndrome UK group, our Dravet support group in the UK. And Dravet syndrome is a monogenic epilepsy by and large, but we all know that people with Dravet syndrome can have considerably different phenotypes. How different individuals with even the same condition will be affected as a result of all of these other changes going on, we simply don't know. We don't know how they're going to respond to the multiplicative, complicated effects of climate change. But what we do know is that those with less resilience are likely to be affected first and more significantly. And we know that often people with epilepsy, especially those with severe epilepsy, do have less resilience to the challenges that climate change will pose. And this is all happening around us and likely to get worse. What can we do? We know this is happening. We know that it can potentially have many consequences for people with epilepsy. What can we do? I guess the first thing to think is, what do people with epilepsy think about this? We are all in this together, but we need to know what it is that people with epilepsy think. This is a survey that we recently carried out. And actually, we did this after a series of periods of hot weather, unusually hot weather in the UK. And this survey was of about 1,000 people across the UK with epilepsy. And I think this is probably the key finding here is we asked people whether they would be interested to see more work being done on the consequences of climate change for people with epilepsy. And overwhelmingly, people with epilepsy said, yes, they wanted to know more what was going to happen. And when they thought about whether climate change would affect them or who it would affect most, they were clear that it's going to have an impact on everybody. This includes people with epilepsy. So here again, you see, this is a more detailed survey. We did a subsample of this 1,000, and the opinion of these people was that it was likely to affect everybody. Were people concerned about climate change? This is people with epilepsy in part of the more detailed survey, so a smaller number of people in total, but you can see that the majority of people were concerned about climate change. The majority of people with epilepsy who we asked were concerned about what climate change would do for epilepsy. I think there's a question of whether this is something we should be discussing or not, whether it's going to make people anxious, especially as actually we don't have many facts on the ground. We just, I think, can anticipate that things might get worse. And this is fairly balanced, actually. There were some people who felt that it did affect their mental well-being, but here you see a slight majority of people thinking that it wouldn't. They wanted to know more about it and what would happen. We asked who should be responsible for tackling climate change. And again, you see here that their view was that this was everybody's concern, which includes us, of course, as professionals involved in epilepsy. So what can we do? I guess the first thing is we need to know more. We need to know the facts. How will this affect what we do? How will it affect people with epilepsy? How can we affect it? We need, I think, to think about this broadly and to raise awareness of this problem. We can't bury our heads in the sand, neither should we be keeping this from people with epilepsy whom we look after and see in our clinics. And we need to actually take some action. So research is going to take time, but there are things that we can do in the meantime that are likely to be generally useful. So this is, I guess, our first attempt to try and bring this to wider attention. This was a paper we published last year on climate change and epilepsy, just thinking about the issues that there might be. And it was very interesting in this to work with climate scientists, so Hayley Fowler and Ian Lake and Adine Foley are all climate scientists. And I have to say, it's really very interesting, informative to work with climate scientists to understand the way that people who think about this all the time consider what's going to happen, to understand from them the uncertainties around all the information that we have put to us through the media all the time, and to understand the depth of change that is likely to occur, but also the amount of work that's being done on this that we can access, that we can bring into our understanding and research into epilepsy and how it might be affected by climate change. So, for example, in epilepsy climate change, our own organization, looking at these things, we started to do a number of different things on the research front, engaging with organizations such as, for example, Dravet Syndrome UK, to gather their lived experience of what happens with heat waves, for example, what happens to the children, the families in these organizations. We're finding already that they have more seizures, that they are more lethargic during heat waves, and so that there are consequences that they are already experiencing. We've undertaken surveys of opinions of people with epilepsy, as I've shown you just now, some examples. And we're beginning to gather information on seizure patterns and severity and frequency with changes in temperature, especially with heat waves. We're looking at the existing information that's out there, some of which I've presented, which we can use to think about how climate change might affect epilepsy and to try and focus on areas of interest. And we're doing some studies of the effects of temperature and humidity on various aspects of epilepsy and trying to gather longitudinal data. For example, at the Chalfont Centre for Epilepsy, one of the places I work, run by the Epilepsy Society, we have seizure records going back in some cases over 50 years. But we also have climate data for the locality, which extends back for a significant proportion of that time. So we can begin to see how secular changes in temperature may have influenced seizure frequency for a group of people with severe epilepsy. And we're looking at other things, for example, how we can think about reducing the footprint for laboratory studies and trying to reduce the contribution of laboratory studies, for example, to climate change. And one thing to think about here is freezers. So many things in freezers are kept at -80, but in fact, you can probably keep most of those things equally well at -70, and that leads to a significant carbon emissions saving. One of the things that I think is really interesting is to look at national level observations. So this is work that Diego Jimenez and his colleagues and I've been discussing, looking at, this is Ecuador, and Ecuador, I think, has a number of features that I think make study of climate change and epilepsy particularly valuable here. We know that the healthcare systems there are sometimes precarious and sometimes, of course, may be prone to problems associated with climate change. And Diego and his colleagues have information about epilepsy admissions to hospital, epilepsy-related admissions to hospital, as well as temperature, humidity, and a range of other phenomena. So that at a national level, we can begin to see what impact changes in weather, changes in temperature, and potentially effects of climate change can have on epilepsy at a national level, which can help guide policy and further research. If we think about what we can begin to do, because we can't wait for years and years to get all these research results, these things are happening around us now, we need to be acting now. The National Health Service in the UK is the largest public body, is the public body with the largest greenhouse gas emission in the UK, actually in the whole of Europe. The NHS each year produces 21 million tonnes of carbon dioxide emissions, which is equivalent to the whole carbon dioxide emissions of Northern Ireland. The main contributors from the NHS are the use of buildings kept at particular temperatures with lighting and heating and computer use, pharmaceuticals and their production, and travel. And in fact, 5% of all road traffic in the UK in the year 2007 was due to health service activity. It's a huge proportion. So you can see here, this is from the Department of Health and Social Care in the UK. You can see the kinds of things that are contributing to the climate, to the greenhouse gas emissions from the NHS, particularly medical instruments and equipment, pharmaceuticals, and here you can see all sorts of different areas that have been looked at that contribute to greenhouse gas emissions. And by getting this sort of data, we can begin to see where we need to focus our efforts in order to reduce the contributions of healthcare to climate change. These are actions that we can take, and we need to be taking them swiftly. So these are projections for what will happen. This is the 2013 baseline carbon dioxide emissions for the health service in the UK. This is what we need to be doing to meet the targets that the UK government have set. And this is a projection of what's actually going to happen. There's a real need to act swiftly and act now. There's a lot still we need to do if we really seriously want to reduce carbon dioxide emissions ourselves. What can we do? This is a really interesting paper, I think, that is well worth reading, which shows the activities that we as individuals, and we may choose to do this or not, but if we think about people with epilepsy, then we know that climate change is likely to be have an effect on people with epilepsy. And so we should be thinking about what we can do ourselves to try and reduce the impact that we have. And what these authors showed was that there are certain activities that lead to significantly greater benefits than other activities. So upgrading light bulbs is a very easy thing that we're all told to do. But actually the amount of saving this produces is small. Whereas if we don't have a car, That makes a big difference that we as individuals can make. Or avoiding flying. One transatlantic flight, for example, produces a huge amount of carbon savings or carbon emissions, and therefore not going, producing carbon savings. What's interesting is how this is being put across to, for example, school children. So the same authors looked at what information was being given in high school textbooks. Actually, this is in Canada. None were being told to have fewer children if they went on to have children, which is the biggest impact that actually any of us can make. And none were being told about, for example, dietary changes that could have a big impact. Many were being told about things that actually might not have a big effect. For example, here we see conserving water, a good thing to do because that water stress will be an important part of climate change, but has a low impact in terms of carbon emissions. So we need to get the right information. We need to get more information from a research perspective, but we also need to be giving the right information to everybody that we're involved in, whether that's, for example, to the management of our hospital systems or back down to people with epilepsy when they want to know what they can do to try and reduce their impact on carbon emissions. This is a graphic for which I'm grateful to Ingrid Scheffer and Dan Lowenstein for their contributions. So this is, if we just focus, for example, this is me, okay? So this is the average annual carbon dioxide emissions per person in the UK. It's about 6 tons a year. This is the extra carbon carbon emissions I was responsible for as a result of my flying around to conferences for epilepsy. So it's about 50% of the average output for anybody in the UK I added extra as a result of flying to conferences. This is Dan's extra contribution here, not significantly much more, I guess you'd say, but still an increased contribution. And this is Ingrid's. And this is not to say that Ingrid is particularly irresponsible in any way at all. Obviously, she's got to go a long way to get anywhere to meetings. But you can see that contributions are increased by our travel to conferences. And that's just travel. This is not to think about what we do when we get there, the taxis we take, the hotels we stay in, the air conditioning that we require. And when we asked people with epilepsy what they thought about us all flying around, should we do it or should we not do it? Well, some people thought that we should definitely do it, and some people thought we should never do it, roughly in equal proportions. And what a lot of people thought was that we should find alternative ways to do what we do in meetings. So, for example, what we're doing here, reaching an audience distributed across the world without any of us actually having traveled. So what can we do practically? There's a lot of different things. And as epilepsy professionals, there are many of these things we can already consider. For example, we can think of new ways that we run our clinics. One of my colleagues in the UK has done a calculation showing that if he, as an epileptologist, goes out to peripheral hospitals as an individual, rather than getting all those people with epilepsy from peripheral areas to come to a central clinic, that can lead to a significant carbon saving. It's pretty obvious, really. And of course, many of us work in these hub and spoke models where we might spend most of our time at a center, but go out to peripheral clinics. That makes a difference. We need to think about the value and the cost of travel. We need to think about how we contribute to carbon emissions through, for example, conferences. We need to think about how we can make our practices more sustainable in our laboratories and offices, maybe not changing our computers so often, maybe turning the temperatures up in freezers, maybe turning the temperatures up for air conditioning so it's not 18 but maybe 21, or the other way around, maybe not increasing the heating to 21 but keeping it at 18. We need to think about all the things that we buy, and a simple rule of thumb is the more expensive it is, the more carbon emissions have been involved in its production. And we need to think about, as agents with, I suppose, some impact in the way that societies are run, with perhaps some influence on the way that policies are set, we need to be talking to governments and administrations and healthcare providers. We need to be gathering information, gathering research, and then disseminating that. Robust information, robust research, not just hearsay, but we need to be able to start to do that. So practically, we can travel less. We can become as paperless as possible using electronic systems where as possible. We can triage clinics to decide, actually, does this person need to come to clinic? For many new patients with epilepsy, absolutely, they will need to. But do all our follow-ups need to come to our clinics, or could we sometimes do that remotely? We should be thinking about supporting telephone clinics where appropriate. And the pandemic, of course, has pushed many healthcare systems to that necessarily. And we need to think about how we can keep those things going. Interestingly, we can think about rationalization of medication, because medications are the production of medications are important contributors to carbon emissions. So we need to think about rationalizing medication, not just because of the consequences for individuals of being on polytherapy, but also because of the broader issues of the carbon emissions involved in production of anti-epileptic drugs. This is not to say we compromise care in any way, but we really need to think about what we're doing when we start additional drugs. We can join hospital sustainability groups. We can lobby for change and work with our colleagues to try to reduce what we as individuals might be contributing. And for example, we need to have meetings like this where remote attendance is possible and encouraged. So for example, if we ask people with epilepsy whether they would be willing to have remote conferencing, remote clinics and remote consultations in the interests of reducing carbon emissions, then the majority said yes, always, or sometimes they would be willing to do this. And I think we've seen that happen through the pandemic. And we need to make this possible. So this is the colleague who did the calculation that's showing that if he went to a peripheral clinic, he led to a net carbon saving. We need to make it sure possible, for example, that people can cycle, and then when they get there, they've got somewhere to put their bikes. Very simple changes that can have a big impact. And in my own opinion, this is something we need to be getting on with. As these children at a protest said, there is no planet B, there is no plan B. We have to do this now, if not for ourselves, for the people to come, for the people that we look after with epilepsy. In my own opinion, this is a moral obligation. You know, we're all interested, of course, in research into epilepsy itself. And it's important to us to progress in our careers and to write papers and to get grants. But unless we think about this in the context of what's happening in the whole world in which we work, I would argue that it's a little bit meaningless. And as we've seen in the pandemic, our priorities can change, and that can work for the best. And in my own opinion, that's what we need to do also for climate change. So I'd like to thank the organizations, Epilepsy Society in particular, that have helped support the work I'm doing in this area. And I would encourage anyone who's interested to join up at Epilepsy Climate Change, which is just a group of people who feel concerned about this and who are all contributing fantastically to organizing surveys, to gathering information, to doing research on the effects of temperature and humidity change and its consequences for people with epilepsy. So this is the link if you want to join up. And you may have your own local groups too. For example, in the UK, we have the Association of British Neurologists Sustainability Special Interest Group across neurological diseases, not just epilepsy. And there are likely to be similar organizations in many places across the world. So there we are. I'd like to stop there and thank you for your time. And I'm very happy to take questions if that's the next step.
Thank you, Dr. Sisodiya. So we have several questions from the audience.
Yeah.
So the first one is, should we raise awareness about this issue to pharmaceutical companies which produce anti-epileptic drugs?
So I think the answer to that question has to be yes. And in many cases, actually, some of these organizations are ahead of us in their thinking. So just as one example, I know that there is one pharmaceutical company involved in the production of anti-epileptic drugs who have set themselves a number of targets with respect to climate change to reduce their carbon emissions. And there is, for example, a healthcare provider organization in the United States that has committed to becoming carbon zero by a specific not too distant time in the future. So I think yes is the answer. I suspect that many of these organizations are already thinking about it, especially if they're responsible organizations, because it's going to affect them. It's going to affect the way that they practice. So absolutely yes.
Okay. And so another question is, will it be reasonable to raise awareness among doctors to start recollecting a seizure diary that comes along with a temperature diary?
Yeah, well, I think that would be interesting as part of the exercise of gathering information, and that would be great, of course. These things are complicated, and one thing I've learned is that as somebody who's interested but doesn't have expertise in this area, some of my own thinking about climate change is very naive. And I've learned a lot from working with climate scientists. So I think it's absolutely something we should do. But I would recommend that we interact with climate scientists, including local climate expertise, to find out the best way to do this, and the best way that information can be gathered. And if we can do this systematically and begin to put this information together across the world, that would be fantastic. As we're seeing, Diego's leading work in Ecuador, we're doing some work in the UK, we should all put it together.
That's very interesting. So another question is there any evidence that mesial temporal sclerosis will have an increment in seizure rates caused by these heat waves?
I don't know that there is any evidence about that at the moment. I think we can speculate about how there could be, but I'm not myself aware of hard data on that at the moment. But I think that's the kind of thing that we need to gather information about. And one of the things I think that's interesting is I think most centers are seeing that the number of people they see with mesotemporal lobe epilepsy with hippocampal sclerosis seems to be declining. And sorry, one reason that's been proposed for that is that there is better care of febrile seizures in childhood, infancy. But what we're also thinking is that actually as global temperatures rise, then there may be a recrudescence in the occurrence of febrile seizures, especially as we know that some genes, variants in which are involved with febrile seizures are themselves sensitive to temperature change. The proteins they encode are sensitive to temperature change. So we potentially may see a recrudescence